I'd like to talk to you about holding insurance companies accountable. So that there are no more cures. My name is Lisa Kantor, and I am a partner in Kantor Kantor. And with only 13 lawyers and a staff of 12, we are proud to be the largest law firm in the country, focusing our practice on representing individuals whose employer-provided health, disability, and life benefits have been improperly denied. Since we opened our doors in 2004, we have helped over 1,000 people recover the benefits to which they are entitled. This is not an easy task. ERISA, which stands for the Employee Retirement Income Security Act of 1974, governs all benefits which an employee gets as a result of employment, such as health insurance. And most of you probably, if you have health insurance, have it as a result of your employment. And while this act was intended to protect employees, it has been interpreted by the courts so as to largely protect insurance companies, and has become a morass of confusing regulations and laws, which has led one federal court judge to rename it "Everything Ridiculous Invented Since Adam." Most importantly, ERISA limits the remedies available to individuals when an insurance company violates its obligations under an insurance policy. This means that the worst that can happen when an insurance company improperly denies a claim is that maybe a year or two later, a judge will order that insurance company to pay the benefits it would have had to pay anyway, and maybe some fees to an attorney. And insurance companies know this. So when they are deciding whether to pay claims, they can deny valid claims with impunity, knowing that the likely result is that the patient will just give up, and the worst that will happen is that the insurance company will have to pay the claims later, assuming the patient is lucky enough to find a lawyer willing enough to handle their ERISA lawsuit. Nothing in ERISA makes insurance companies care about the patients whose claims they are considering. This reality has had a particularly dramatic impact on eating disorder patients, which inspired me several years ago to focus my practice on this population. Let me give you some examples. One of my first cases involved a young woman who started college and came home to tell her parents that she was anorexic. She had coverage through an HMO. The HMO would not allow her to see a medical doctor, as she had already had her yearly physical before she left for school. She finally got an appointment with a psychiatrist who knew nothing about eating disorders but was happy to prescribe some medication, and a psychotherapist who admitted that the HMO had no eating disorder treatment available but was working to set up a program. The HMO offered her a once-a-week drop-in group therapy program, but she was the only one who dropped in. And the woman's weight was rapidly declining and her mental health was spiraling down. So her parents took out a second mortgage on their home and paid for treatment at a residential treatment center. 30 days later, she was discharged. She enrolled in community college. She got a part-time job. She became involved in her local church. But her insurance company refused to cover this life-saving treatment, which allowed this woman to recover her life and go back to school. So we filed an ERISA action in federal court, and we lost at trial. We filed an appeal with the Ninth Circuit Court of Appeals, and nearly 5 years later, nearly 5 years after she was discharged, we won. The Ninth Circuit was appalled that the HMO nearly let this young woman die and offered her a once-a-week, non-existent group therapy session. And we managed to recover the full cost of treatment, plus interest and attorney's fees. Let me also tell you about Kim. Kim has had an eating disorder since she was a teenager. She managed, however, to get through nursing school, get married, and have a child. After she miscarried her second child, she relapsed, blaming herself for the miscarriage. She was running 80 miles a week. She ate about 500 calories a day. She weighed 76 pounds. She was in day treatment, but it wasn't working. Her psychiatrist and husband finally convinced her that she needed residential treatment. But as she was packing to leave, her insurance company called her and told her she was not sick enough for residential treatment. Somehow her family scraped together enough money to send her away, borrowing from their retirement plans and savings accounts. But as that money was running out, they called my office. We submitted a request for an independent review to the California Department of Insurance. Unfortunately, the decision ordering the insurance company to pay came the day the money ran out, and Kim was on a flight home. There was no convincing her to return. She tried to kill herself 3 times within the next 4 months. She now describes herself as a STEM, not worth the space, time, effort, or money. And finally, there was Sophia. Sophia had been kicked out of treatment because her health insurance company stopped paying so many times before that she did her own fundraising campaign before she started residential treatment again. Once again, insurance denied before she was ready to discharge. The California Department of Managed Health Care ordered the insurance company to pay. That was nearly 30 days ago. They haven't paid yet. People who have insurance should not have to raise or borrow money to pay for their care and then worry about their insurance company improperly denying coverage. So I spend my days helping individuals try to get their insurance company to honor their legal and contractual obligations. I know you know how frustrating it is for mentally ill patients and their families at a time when they are most vulnerable to discover that the insurance company to whom they have paid premiums for years is refusing to cover the life-saving treatment they need or their loved one needs. Even the process of trying to access care is confusing, burdensome, and often humiliating. If you have ever received an explanation of benefits from your insurance company, you might begin to get an idea of what I am talking about. If you really want to start to understand the problem, go home tonight, try to find your health insurance policy, and if you can find it, try to read it and understand it. I have been doing this for years, and I still have to read policies over and over again before I begin to understand them. But insurance companies know what their policies say. They understand what claims they're obligated to pay. So why, you may ask, are eating disorder patients having such a hard time getting access to treatment? Why are insurance companies denying coverage for legitimate claims? The answer is simple: because they can. Because no one is holding them accountable. They are not required to understand eating disorders. They are not required to apply medically accepted criteria in determining whether to cover treatment, and they are not required to apply universally accepted criteria so as to provide access to the appropriate level of treatment. The FREED Act will help change this. The stories I hear every day are similar. A patient is in residential treatment because her doctor, her therapist, her dietitian, all of whom specialize in treating eating disorders, believe that it is medically necessary to treat her at that level of care. Perhaps she is restricting so much that her health is at risk. It takes her 2 hours to finish lunch, but with the care and guidance of the clinical team, she eats enough calories to satisfy them. She is still trying to water load before weigh-ins, must be watched when she uses the bathroom to make sure she does not purge, and has to sleep with the door open to make sure she does not get up in the middle of the night to exercise. Perhaps she is on wheelchair restrictions some of the time because she is trying to constantly move to burn the normal amount of calories her treatment team is requiring her to eat. With the team's expertise and guidance, she is slowly gaining some weight, and because she is no longer malnourished, she is beginning to be able to deal with the severe psychological and psychiatric issues which underlie her disease. Her family begins to see a glimpse of the person she once was, and she begins to feel like maybe there is hope. Maybe she has worth. Maybe she can create a life without her eating disorder. But a mere 2 weeks into treatment, her insurance company decides the treatment is no longer medically necessary. How does this happen? Insurance companies refuse to recognize that effective treatment of eating disorders takes time. Instead of allowing medical professionals to make medical decisions about treatment, the insurance companies require the providers to repeatedly call to get authorizations to treat her for more days, often 2 or 3 or 4 days at a time. Instead of spending time treating patients, providers are on the phone with insurance companies. The providers, of course, are intimately familiar with the patient. They are able to give the insurance company detailed information about the patient, the course of her disease and treatment, the reasons why continued treatment is medically necessary, and the medical and psychological challenges she faces. This is done over the phone, sometimes to a layperson who takes notes and gives those notes to a doctor, or sometimes directly to a doctor. These calls typically last between 10 and 30 minutes, but in that short period of time, the insurance company representative, without ever having met the patient or looked at her medical records, makes a life and death decision denying coverage for treatment. After all, they say, she's eating right, she's gained weight, she is no longer restricting or purging, she says she's feeling better, she's improving, certainly she can continue her treatment on an outpatient basis. Of course, the insurance company ignores the fact that she's only eating because her treatment team sits with her, offering therapy through her tears and her anxiety, so that she's able to eat. She's only no longer purging because she's supervised 24 hours a day. She is feeling better because for the first time in God knows how long, she is not malnourished. She cannot do this on her own. Moreover, in reaching their hasty conclusion, each insurance company creates and applies its own guidelines, which it says defines when each level of care is medically necessary. Some insurers have strict weight requirements. Some require patients to fail at lower levels of care before they are allowed access to higher levels of care. Some insurers will not cover eating disorder patients who they deem to be chronic. Could you imagine if we treated our physically ill this way? Would we allow an insurer to tell a diabetic who could not lose weight or comply with a certain meal plan that we would not pay for her insulin because she allowed herself to become chronic? Would we ever tell a patient who had a heart attack and suddenly needed bypass surgery that she should try medication first? The FREE Act will put an end to these practices by requiring each insurer to follow universally accepted criteria as set forth in the American Psychiatric Association practice guidelines for the treatment of patients with eating disorders. This provision will make it much easier for providers to get claims paid and for insureds to convince the courts that their claims should have been paid. Another problem is that insurance companies often consult with doctors who are completely uninformed about eating disorders and their treatment. I have had an insurance company doctor tell me in a deposition that eating disorders do not exist unless the patient's jaw is broken. I have seen notes from insurance company doctors who seem to believe that the failure to eat is a choice rather than a disease. I have read insurance company notes claiming that the family of an eating disorder patient will just have to deal with the patient's behavior at home because she has had too much treatment. And I've seen countless denial letters from insurance companies which contend that the patient was not motivated to recover and therefore was not entitled to benefits. And then, to add insult to injury, Insurers end all of their letters by saying that they are not making decisions about treatment, just about coverage. Who are they kidding? Who of us can afford health treatment without accessing our insurance benefits? The research initiatives, establishment of the research consortiums that will provide training and fund research, as well as the training of all health professionals contemplated by the FREED Act, will be instrumental in reversing this trend in the conduct of insurance companies. These provisions will ensure that all health professionals are better educated about eating disorders so that these types of uninformed, unscientific denials of access to care do not continue. I applaud the drafters for the inclusions of these provisions. In closing, I want to thank you for this opportunity to speak to you today. And let me leave you with a thought I paraphrased from Warren Buffett. Let's say that it was 24 hours before you were born, and a genie appeared and said, "What I'm going to do is let you set the rules of society in which you will be born. You can set the economic rules and the social rules, and whatever rules you set will apply during your lifetime and your children's lifetimes. And you'll say, well, that's nice, but what's the catch?" And the genie says, here's the catch. You don't know if you're going to be born rich or poor, white or black, male or female, able-bodied or infirm, mentally well or mentally ill. Or as Mahatma Gandhi said, a nation's greatness is measured by how it treats its weakest members. It is time to hold insurance companies accountable. Instead of them setting their erroneous rules that prioritize money over lives, we need to set the rules and put the value of human life at the top of the list. Congress can do that by passing the FREED Act. We urge your support. Thank you.